welcome to the Better Health, Better Kentucky. And this is a special podcast. It's our first podcast, one of many that we're going to be producing. And what our goal is to try to bring community experts and local health departments together so that the general population of the residents and Kentuckians have a better understanding of the opportunities available to them regarding better health in Kentucky. Today, I'm joined today by Andrea Viney. She's a public health director from Bourbon County Health Department, and she's going to be providing a plethora of information to us on what the state does and how that happens. And I'm also honored to be having Tammy Riley on. Tammy's a regular on our local podcast. Tammy's not only the president of the Kentucky Health Department Association for this year, but she's also the public health director for Pike County's health department. You know, I know that one of the goals from KHDA is to kind of have a better awareness and more tools. And one of the tools is this podcast that will be on various outlets. So, ladies, welcome to our inaugural podcast, one of many I hope that's going to be future. Our goal is to make this informative. Our goal is to be informative, let people know what's happening, let people know how to get in touch with their local health departments, what the health departments can do for them, and just an overall view of what the Kentucky Health Department Association does. So welcome, Tammy, and welcome, Andrea.
Thank you.
Thank you so much.
Thank you, Jeff. We reference Kentucky Health Department Association informally as KHDA. So KHDA, or the Kentucky Health Department Association, what is that? It is a membership organization that represents all 61 local health departments across the Commonwealth. The purpose of the association is to provide support and to strengthen those 61 local health departments and the communities that they serve. So that's ultimately, who or what rather KHDA is, and the overarching purpose of the association.
All right, Andrea, real quick, you hit on something, Tammy, and I want to have a clarification. Out of 120 some odd counties, not every county's got a health department. So there may be several counties that are combined together. That's the reason why there's only 61 in the association, correct?
Actually, all 120 counties are represented by a health department. However, some counties are grouped into a district.
Gotcha.
So in Kentucky, there's 61 local health departments, but of those 61, 44 are single county, but 14 are districts. So like Cumberland, for example, has 10 counties.
And Kentucky River
District has 7.
Gotcha.
So that's probably geographically in the east, the closest district to my county, Pike County, for example. And Andrea, also, you represent a single county, correct, Andrea?
Yes, correct.
And I'm sure you have a district nearby.
Yeah, right above us is Wedco, which is a 3-county district. Yeah.
So those counties have health departments, but they're grouped together in a district with a governing board of health.
Okay, and that's great information. Part of this podcast is to be informative and educational. So, and I know I'm jumping ahead because I really want Andrea to chime in here. But if people go to the website, which would be the khda-ky.org, go to that website. And you could find on the website your particular county if you have any information. So, and I'm sure Andrea will talk about that. So, Andrea, welcome to our podcast. Tell me what's going on.
Thanks for having me. We're excited about launching this new platform to really just get our citizens across the state to understand, what health departments do and how to access our services and that type of stuff. In KHDA, I'm the communication chair, so that's kind of my role is communications, and so this was one of the ideas that came out of our strategic plan was to start a podcast, trying to get with the times, and really try to reinvent some new ideas of how to reach the population. So that's one of the reasons why we wanted to do a podcast, was just because it's a little different, and hopefully we can reach a lot of people who may not know what we do. A lot of people don't think they access our services because they don't ever walk through our doors, which is completely not true at all. And we can talk about that like on down the road when we get into specific programs that we do that serves our entire communities. But just briefly to get people to know who we are real quickly is if they go to our website. And if even on the front page of our website, if you scroll down, you can click on your county, and then it pops up exactly, or you can even see like the map of Kentucky and hover over your county, and you can click on that, and it takes you directly to that website of that local health department. And then you can learn everything you need to know about the health department in your community. So it's an easy access point for people to find out where their health department is, what services do they offer, or looking at maybe neighboring counties and what services they offer. But also on our website, there's other resources people can click on, like job opportunities. We actually have student internship opportunities that people can click on and learn from. We have our CALBO, so that stands for the Kentucky Association of Local Boards of Health. And like Tammy was mentioning earlier, that we're governed by our local boards of health. So there's a place on our webpage for information about our local boards of health as well. And then we also on our webpage is AmeriCorps, which is a program for people to join the AmeriCorps program. But our website has a plethora of information to learn everything you need to know about your local health department.
What is, if you guys had to tell me in so many words, what do you feel is the role of CADA as it relates to a healthy Kentucky and as it relates to specific health departments?
The association ultimately provides services, like shared services and a shared voice for local health departments. But there's many services that strengthen local health departments that are shared through the association. There's been, in most recent history, a tuition scholarship program that staff could apply through this program, and it's helped strengthen public health workforce throughout the Commonwealth. So those are just a couple of examples of many benefits of those 61 local health departments that they gain through their membership with the Kentucky Health Department Association.
And not all health departments are the same. So what affects people in Muhlenberg County may not affect people from Bourbon County, and what's happening out in Callaway County doesn't happen in Fayette County, and so on. But I think if and correct me if I'm wrong, but I think that the association also has it's kind of like a pooling place. So if a particular county is doing something that works, maybe the association then says, okay, this is what Callaway County is doing or Bourbon County is doing, and then they share it, and either they incorporate that or they don't. Would that be a fair assessment as well?
You commonly hear people in public health say, when you've seen one local health department, you've seen one local health department, because we're all different in that we are addressing local community needs, and gaps in service in the East are not going to be the same, and gaps in services and needs in Central versus West. But at the same time, in Kentucky, we have an approach to public health called public health transformation, but it has standardized services in the Commonwealth, in that our services, regardless of East, West, Central, North, South, falls into three broad categories, and they're foundational, and those services are mandated by statute and regulation, or they're core, and that means that all health departments either provide or ensure that they're available to the community, and that's WIC, HANDS, and harm reduction. And then there's the third category called local priorities or local needs, and that's where communities are unique, and those community needs, and I'm sure Andrea could speak to that and the differences that we see across the Commonwealth.
Andrea, what kind of things do you see that are different? I know you're communications director, and I've got a couple things that I want to talk to you about, but what do you see across the state that may be different, but we're all Kentuckians and we all want to be healthy, and the goal is to make sure that we're disseminating information and getting people as healthy as possible. But what kind of trends are you seeing, or that health departments are doing, or that is important for the association to kind of make sure that they're disseminating to other folks?
One thing that local health departments are required to do is called a community health assessment. And we do this every 5 years. And a lot of times we partner with our local hospital if we have a hospital in our community, because they also are required to do a community health assessment. And this really just surveys our community. We look at a lot of different things. We look at data. We actually survey people in our community to get their opinions on what they think the problems are. We get together and have a couple different forums digesting that data and looking at, what really are the big gaps and what are the big issues in our communities. And all the 61 health departments across the state do this, and they have varied outcomes. They had different outcomes based on what your resources are in your community, because my resources here may be different from Tammy's resources in Pike County. And so that might mean our issues are a little bit different. Like I can speak specifically on Bourbon County. And like we did our latest community health assessment back in 2022. And we had like three major issues that kind of trickled to the top after we did this whole process. And it was mental health, alcohol, tobacco, and other drugs, and housing was our biggest affordable housing, were like our three biggest kind of issues that we decided we want to tackle for the next 5 years. And so, but that can look very different in the communities across the state. And that's why Tammy was talking about that third bucket of local priorities, is that's where health departments get the flexibility to kind of choose and decide which programs that they want to work on, or which issues they need to work on. And then they can push funding or write grants, or to really focus on those specific needs in that community.
And you're encouraging your local health departments to make sure they're disseminating that information out to the public and to the communities of which they serve, correct?
Absolutely, yes.
Good. That's
That's
fantastic.
one of the reasons, I'm sorry, Jeff.
All right, Tammy.
No, that's one of the reasons we wanted to do the podcast. It's,
Yeah.
we'll reach a different population. You have, and you know this, Jeff, but you have different mediums for communication, and what you will put in print may not hit completely the same population than what you put on social media, and even what platform you use on social media hits different, or the reach is to a different population versus a podcast versus, maybe a TV, video, radio. So, the podcast is another avenue as part of that goal.
The association encourages each local organization, if you will, to partnership with people. And I know that there's some partnerships with universities and health departments and colleges. Tammy, kind of what does that look like in 2026? How is that partnership going to foster, and what does it look like going forward?
Well, you really are hitting at the association's strategic plan. So every 2 years, we reevaluate our strategic plan and update that process, and look at our priorities as an association. And currently, we have 4 strategic focus areas, and it's to have a healthier association, to have healthier local health departments, to have healthier partnerships. And I think that's what you were asking,
Right, exactly.
referencing, and then also to have healthier local communities. But in the partnership focus area, we have many important partners. Academia is one, for example. We work with post-secondary institutions across the Commonwealth, those with public health programs, and those without. We're looking at environmental workforce development, for example, as a key focus area currently. We've partnered with state institutions for data analysis, for impact of our programs. In other words, we've looked at specific services that all local health departments offer through regulatory services and the impact of what public health and communities would look like without those services. And there's a program through the University of Kentucky called RADOR, and we work closely with them. I've personally worked with the University of Louisville on a leadership program and local world changer project. So there's many partnerships that have involved our academia. And then there's also other associations in the Commonwealth, like, for example, the Kentucky Public Health Association and others that we partner and have shared advocacy for the best public health outcomes, possible in the Kentucky. Andrea, I don't know if you want to add anything to that, but healthy partnerships is very important to the associations, post-secondary institutions, other associations, and nonprofits.
Like, we can't do this work alone. There's just way too much to do it alone, and we don't want to silo ourselves. Public health is about serving the population, and sometimes I think general people out there may not understand exactly what we do, but that's why our partnerships are so important, because we can't do it all alone. And so, working even locally, like working with our hospitals, working with our schools, working with our first responders, and our business communities. Those are so important for those partnerships, even at the local level, to get the work done, because there's just no way we would be able to get it done alone. So we rely on those very tight-knit relationships, building those relationships in our communities and at the state level to make sure that we're all fighting the same fight here.
Sure.
No.
I hate to breach this subject, but unfortunately, politics plays a role in everything that we do. And I notice that you on your board and your members, there's a lot of doctors and physicians and stuff like that. How important is it, Andrea, as being the communications director, to make sure that the lobbyists who are working with your local, even the statewide legislatures, who are actually in session as we speak,
Mhm.
how important is it to make sure that they're armed with the right information, so that when funding opportunities become available to local health departments, that our legislatures say, yes, this is a vital part of our society, and we need to fund these projects? How important is it for the association, local health departments, and you as communication director to disseminate that information properly?
So we have an advocacy team on our KHDA, and they do a fabulous job of prepping and preparing the KHDA, the other local health department directors, with what's happening in legislation. We also work with a company called the Babbage Team. They're fantastic, and we recently, I guess it's been like what, 3 or 4 years that we've brought them on to be our advocate and helping us with the legislation, and helping us learn about the legislation and how we need to talk to our legislators. And our advocacy committee does a really, really good job at helping us talk through things, and just training us as local health departments, because we're not all local health department directors come from different backgrounds, and we don't all have strengths of like going and talking to your legislators. So they do a great job at training us and building us up, and arming us with the right materials to go and talk to our legislators. We have a legislative day coming up in February, where it's a public health day that as many health department directors as we can will come, we'll meet, we'll set appointments up to talk with our legislators about the current events that's going on in public health, and why we need their support to pass the budgets. I'll let Tammy kind of jump in a little bit more about the details behind that.
So, Jeff, I think we're talking about advocacy work. So what we do as public health is we're apolitical. And so we don't lobby, but we do advocate by providing legislators with public health information so that they can make the best decision possible. And we have an advocacy committee who, guides and assists. Like Andrea said, we're not all savvy with, advocating and speaking to legislators or understanding the government process, for example. And the advocacy committee guides us, and the association does have the Babbage team that provides some additional support at a higher level. But we also have CALBO. I think we talked about that early on, the Kentucky Association of Local Boards of Health. So those 120 counties have boards of health that consist of doctors, nurses, dentists, veterinarians, consumer lay people, and fiscal court appointees, engineers. So we have locally subject matter experts that can speak on our behalf and on behalf of public health. And then we have a statewide association, CALBO, who also provides advocacy and support. And so those, CALBO and CADA, we support one another frequently. And
Right.
so that's kind of how that works. But
Okay.
public health, we remain apolitical and just provide public health advocacy and information.
Fantastic. What do you think the biggest challenge to Kentuckians and to local counties are regarding public health at this time? Andrea, what do you think the biggest challenge from the association's viewpoint is?
We're always advocating for the funding to be there. We can't do what we do if we don't have the funding to support our work. We can't do what we do if we don't have the workforce to do the work, so we're constantly advocating for making sure our pension subsidies are funded, and making sure public health transformation, which Tammy touched a little bit on, is funded, because that's where the core of our work is. And we're not going to be able to make any changes in our health statuses or in our communities if we don't have the funding and the workforce to support the work that we do.
Sure. And Tammy, I know that you've gotten a lot of grants, and I'm sure that helps when you get those grants for like Pike County. I'm sure you're sharing that information on how to obtain grants through other counties. And how has that helped you with the overall perspective of the organization as a statewide organization?
We do have what's called shared practices, and so there's actually several pathways to sharing information and supporting one another for grant submission. So we have shared practices at the regional and at the statewide level. So local health departments will share programs and funding that they obtained and how they obtained it. We also have a committee. Currently, the focus is opioid abatement, and they apply. And we have Pike County specifically, Bourbon County, and many other counties have benefited from associational grants where the association has applied for funding and then dispersed the funding and provided resources to local health departments. Sometimes all health departments, and sometimes it might be health departments who request the funding. AmeriCorps is one example where the funding has flowed through the association to local health departments. Pike County, we started our naloxone leave behind program through a CADA funded grant. Many of our local workforce development has occurred because of tuition assistance through funding that flowed through the association. So we share best practices, and we also, the association sometimes applies for funding and then it's dispersed locally. So it's a bi-directional benefit.
Right, fantastic. One of the things we talked about earlier is education and educating the public. How important is it to have health departments in local, like elementary schools, and getting into these students when they're younger so that they can understand what a healthy living is like? Just how important is that, and what does that look like from the association standpoint in the future, 2026 and beyond?
I will say, before I became director at the Bourbon County Health Department, I was a health educator for 18 years at another local health department here in Kentucky. And that's what I did. I went into the schools and did a lot of kind of sex ed education, team, just youth development education, tobacco cessation, tobacco education, prevention programs, And I mean, that's that's the core of where you're going to learn. We rely very heavily, our goal is, we want the students to hear it first from home, because we think hearing it from parents is the foundation of the education that we get. But we want to follow that up in the schools, and our schools love for us to come in and teach the students these different topics and stuff, because you know it's just hearing it from another source, and just really driving that in. And it's so important to get it in as early as we can. And I know here locally at Bourbon County, we have recently been able to get one of our elementary schools to start a suicide prevention program, and we think that that's super important to get that in as early. Of course, everything is always age appropriate. We're not teaching anything that is not evidence-based. All of our programs are evidence-based, age appropriate. They've been vetted by the state, and so it's not like we create our own programs and then go in. And I just think, the health education it's one of our foundational, like Tammy was talking about, the things that are required by statute, and health education is one of those. And it's just vitally, vitally important that we get that knowledge into these kids as early as we can. So it really just goes back to those local needs.
Tammy, speak to the health department directors in all 120 some odd counties of Kentucky. What do you want to say to them as far as A, about the association, and B, about Kentucky Health going forward?
Well, like I said, the association is a membership organization, and I think an important point is that the association represents all 61 health departments, are members, covering 120 counties across the Commonwealth. And it's an approach that encourages and strengthens public health systems as well as communities. So we're going to have better public health outcomes when we work together. And that's what the association is about, is bringing those 120 counties, 61 health departments together, providing support and to strengthen public health systems for better outcomes in the Commonwealth of Kentucky.
Fantastic. Andrea, what would you like to leave the viewers with today?
Follow our podcast. You're gonna learn about the inside of local health and why we do what we do. I think sometimes people get lost because we may not always explain our why very well. And so, we've just came off, COVID a few years ago, that we got very much into the spotlight of our communities, and some people were very confused and didn't understand. And so, we want to be able to teach the why that we do what we do, and why it's so important, because like Tammy was referencing our partnership with UK, and they were coming up with a kind of like a flyer with numbers that says the cost of doing nothing. And it's like, if you didn't have these services, what would our communities look like, and how much more sick we would be? Our communities would be a lot more sick if we didn't have public health services. So follow our podcast, and we're going to try to have a lot of different subject matter experts coming on, talking about all the different programs that we do, and just teaching our communities about public health.
Sure. And as we progress, we're going to get topic specific on things that are affecting the health of Kentuckians. Ladies, we're getting ready to wrap up here. Thank you very much for your time. Better Health, Better Kentucky. We're bringing community experts and local health departments together to make sure Kentuckians are healthy. They understand that there are resources out there available to them at the website, khda-ky.org. Go on there, check it out, look it up, look at your local health department, go to your county, hover over the state where your county is, pressing that button. It'll show you a plethora of information. Again, I thank you, President Tammy Riley, Public Health Director for Pike County Health Department. And I also thank Andrea Viney. She's the Communication Director for KHDA, and she's also the communications chairperson. She's also the public health director for Bourbon County Health Department. Ladies, thank you so much for your time. This is vitally important. I look forward to the next one. And I know that we did a 50,000-foot overview of what's going on, but I can't wait to dig into the weeds because I really think this is vitally important to the health and the future of Kentuckians.
Thank you so much.
Thank you, guys. I appreciate your time.